My name is Carol Ann Ham. I am the director of the Addiction Counseling Certification Program at Durton State College. I'm a licensed social worker and I'm also a certified addiction professional. I'm going to tell you a little bit about the program, and perhaps it's something that you might be interested in pursuing. The certificate program consists of 6 classes. They don't have to be taken in the order that I have them listed, except the last one. So we have Families and Other Systems, which goes over various, obviously, family dynamics. You learn how to do genograms, learn about dysfunctional families, how to do interventions, group theory and process. You learn about, obviously, group theory, but you also learn practical skills that you can use when conducting various types of groups, whether it's an activity group, an experiential group, a psychodynamic group, self-help group. You learn counseling theories and methods and how to match those theories up when working with clients. You take Applied Community Health, which is the DSM-5, and also you learn about ADA, which is the Americans with Disabilities Act, and how to work with underserved populations. Understanding and Treating Addictions is the next class, and it gives you the foundation in addictions and various models we use, and you begin learning the skills that are required for addiction counselors. And understanding and treating addictions is the prerequisite for current trends in addiction and mental health. You learn your psychopharmacology and current trends, and also more sophisticated intervention techniques for working with an addicted population. When you've completed these classes, you will have a certificate in addiction counseling. It's something that you can put on your resume forever. You never have to become certified unless you want to, and there are advantages to becoming certified, but there are also advantages to having the certificate. And so what are those advantages? Well, if you want to become a certified addiction counselor, these courses will give you all the required educational hours. So the state boards require that you have so many hours. In Georgia, it's 270. These are all of the hours that you will need in Georgia to meet the educational requirements. Another thing is these courses have been approved by the Georgia Addiction Counseling Association. And because they've been approved by the Georgia Addiction Counseling Association, other state boards have accepted these courses. I'm not saying that they will be, but if you happen to be in another state, you might be able to apply these courses to your state board. Not 100% guarantee, but I've actually never had anyone who hasn't been able to use these courses towards their educational requirement. They also meet the specific educational requirement, meaning the state boards require specific hours in ethics, HIV/AIDS, cultural diversity. These courses have to be approved every year, and they meet those requirements, so you do not have to get any additional educational hours to meet their specification. And I think most importantly, you will have practical skills required in addiction counseling, which can be applied to other types of counseling. And so group therapy for addiction counseling looks a lot like group therapy for other treatment modalities. Same with counseling theories and methods. And since quite frequently our addicted population also has another disorder going on, you learn about working with people who have co-occurring disorders and how to work with those. So yeah, get very practical hands-on skills. The big question is, can you get a job? And the answer is, actually, you can. A certificate in addiction counseling can actually open employment doors for you. And I have real examples of people who've gone through this program who've secured jobs in faith-based drug rehab, crisis clinics, DUI schools, methadone clinics, residential treatment programs, treatment-based prison programs, domestic violence centers, rape crisis centers, and other places. And the reason is because you have those specific skills. And so unlike sometimes when you get an AA degree, you're predominantly sitting in a class learning about theory, because you get more practical application classes, employers know that you can do entry-level work. And so these are the things that you will be able to tell future prospective employers what you can do. You will be able to complete an assessment, also known as a biopsychosocial. You will complete parts of one for a few classes, and you will actually complete one for one of the classes. You will know how to do a genogram, which is what you see to your right, and that's required by several places of employment, especially if you're going to work with families or in K through 12. You'll know how to write a case history. You'll learn how to do a treatment plan and SOAP notes, so documentation skills. You'll learn how to run various types of group therapy, how to use the DSM-5, and that is very important since we have changed from DSM-4-TR to DSM-5. You may actually be ahead of the curve with your knowledge when you go to get hired. You'll learn how to identify various drugs, their effects on the body and the central nervous system. You'll learn what the best practices are in the field today, and a lot more. It's very, very practical application. You still learn theory. You still learn what's behind all this information, but the assignments are very, very, how will I use this once I'm in the field based. Now, I don't want to mislead you. There are things that your certificate in addiction counseling won't help you do. You can't open your own program. So if you're doing this thinking it's a shortcut to being able to open your own treatment facility, you're not going to be able to do that unless you do a faith-based program. And I actually have had a few graduates who, through their church, came through the addiction counseling program and then went back to their church and established a drug treatment program. That you can do. You can't open your own program outside of a faith-based program. Faith-based programs are governed by different rules. You can't bill for insurance. You need a master's degree and a license for that. You can't make an official diagnosis. You can make a diagnostic impression, but you can't make a diagnosis. You need a master's degree and license for that. And you can't immediately take your certification exam. You have to complete work hours and supervision hours first. So who might be a good candidate for this program? Well, if you plan to take a break between your associate's degree and your bachelor's degree, this is probably a good add-on to your associate's degree because it gives you more practical skills. If you know you want to work in addictions, this is a good program for you because at the bachelor's and master's level, you're not going to get this specificity. If you want to be certified someday, this will help you on your way. If you're going to work with a mandated population, so if you're going to be probation, parole, if you think you may be working in an area where people are court ordered to complete something like family therapy, anger management, something like that, we see a lot of addiction issues, substance abuse issues with court-ordered people. If you're going to be in K through 12, so if you think you're going to be in education, and you might say, why K through 12? Well, if you think about it, Kids reflect the environment they're in, and a lot of our kids come from problematic, difficult families with addiction issues. And you'll have that knowledge and an ability to recognize some of those concerns and hopefully be of better service to the kids that you work with. If you want to have the option to work in the field while you go to school, as I said, with a certificate, doors open for you. And so you might be able to get some hands-on practical experience, build your resume while you continue to go to school. And if you want practical skills, now. These are all good reasons to go into addiction counseling. You do need to consider a few things. One, you have to have completed English 1101, 1102, and your general psychology before you can start the program. If you look, with the exception of the Families and Other Systems class, all the classes are 2,000 level classes, and so they're going to have an expectation that you'll know how to put a noun and verb together, and you know your basic psychology. You will have to take an additional 6 classes. The classes may or may not transfer to a 4-year school, depending on your major and where you pursue your bachelor's degree. Some classes may transfer. Some may transfer as electives. Some may not transfer. And again, it's so individualized. I want you to make sure you know up front that you may have to go to the records office or the registrar's office at your 4-year school and ask if they can transfer in these classes, usually as electives. And of course, there is no guarantee of a job. There's no job placement associated with the addiction counseling program. And if you're interested, what you will do next is you'll need to declare a dual major, because I'm assuming that you have a current major either in psychology, sociology, criminal justice, education, any other majors that we offer. And just to let you know, if you want to, you may finish in 1 year. If you start in the spring, you would take Families and Other Systems, Group Theory and Process, and Understanding and Treating Addiction. Then in the fall, you would take Counseling Theories and Methods, Applied Community Health, and Current Trends in Addiction and Mental Health. If you start in the fall and want to finish in the spring, you would essentially take Counseling Theories and Methods, Applied Community Health, and Understanding and Treating Addictions. And then in the spring, it would be Families and Other Systems, Group Theory and Process, and Current Trends in Addiction and Mental Health. I offer the Understanding and Treating Addictions all 3 semesters because it is the prerequisite for Current Trends in Addiction and Mental Health. And so we can play around with the schedule a little bit, but essentially if you want to not come in the summer and finish in 2 semesters, then these would be your course of study, depending on which one you started in. Now, some people spread them out over more than 2 semesters, which is perfectly fine. A lot of people take 2 classes at a time and include the summer semester, and they still finish in 1 year. I know some people have limitations with financial aid, and that's one of the reasons I designed the program so that it can be completed in 2 semesters, fall and spring. And so if you have any questions, if you want more information, you may contact any of the following. You can contact me, and that's my information. I'm in I-123. And there's my phone number, and as I said, I'm the director of the program. Interestingly enough, Lisa Etheridge, who's the next person on the list, used to be the director of the program, and now she is one of the faculty members of the program. She and I decided to trade places. and she will be happy to answer any of your questions, and you can always talk to your advisor. I look forward to hearing from any of you. Please feel free to contact me, and I will get back to you as soon as I'm able, and thank you for considering the program.